Welcome to this explainer where we're going to investigate your nasal health. We're going to figure out once and for all if your breathing issues are just a temporary annoyance or if they actually point to a permanent structural problem. We're basically acting as detectives for your own body today. If you've ever wondered why you just can't seem to draw a full, satisfying breath through your nose, you are in exactly the right place. This isn't just about dealing with a stuffy nose. It's about fundamentally understanding the mechanics of how you breathe every single second of the day.
So, let's dive right into this core question. Is it allergies or is it anatomy? Figuring out whether your chronically blocked nose is just a temporary allergy flare-up or a literal structural issue is the ultimate mystery we are solving today. You know, so many of us just accept bad breathing as a fact of life, right? We treat it with endless boxes of tissues and over-the-counter pills. But what if the problem isn't what you're breathing in, but the actual physical shape of what you are breathing through? Understanding that distinction changes absolutely everything about how you treat it.
Here's our roadmap for today. We'll start with the blocked nose mystery, then move on to 5 signs of deviation. After that, we'll walk through the 2-minute home test, decode your test results, and finally cover when it's time to call an expert.
Let's kick things off with Section 1, the blocked nose mystery. It is time to identify our main suspect.
Okay, so what are we actually looking at? The septum is the wall of bone and cartilage that separates your two nostrils. Now here's where it gets interesting. When this wall is off-center, it physically narrows one side of your nose. This creates uneven airflow that simple congestion medicine absolutely cannot fix. Think about it for a second. The septum isn't just soft, squishy tissue that can easily swell and shrink. It is a solid wall made of bone and cartilage. Plenty of people have a mild deviation and don't even realize it. But when that wall pushes significantly over to one side, it acts as a permanent physical roadblock right in the middle of your airway.
To really get this, we have to look at the difference here. Congestion is just an irritation issue. It fluctuates, it gets better with medication, and eventually it passes. But a deviated septum, that is architectural. It is a permanent physical barricade. You literally cannot medicate a piece of cartilage out of the way. If your blockage is architectural, a standard nasal spray is only ever going to be a temporary band-aid. Sure, it might briefly reduce some swelling around the blockage, but the core physical obstruction is still sitting right there.
Moving right along to Section 2, 5 signs of deviation. Let's go over the clues you can check for right this very second.
If you close one nostril and that same side consistently feels much tighter when you breathe in gently, well, you've just found your first major clue of uneven airflow. Let's literally try this right now. Go ahead and press a finger against the side of your nose to close off one airway. Take a gentle breath in and out. Now swap to the other side. If one side consistently feels like you're trying to breathe through a tiny little coffee straw, take note of that. That's the physical asymmetry we are hunting for.
You might also notice a few other repeating patterns. Maybe you breathe way better on one specific side when you're lying in bed. Or maybe you're constantly waking up with a severely dry mouth because you've been mouth breathing all night. You might even get frequent nosebleeds because that restricted airflow dries out and irritates the inside of your nose. It's fascinating because when you lie down, gravity actually changes how blood pools in your nasal tissues, which can make a structural deviation way more obvious. And that morning dry mouth? That's just your body's emergency backup system kicking in, forcing your mouth open all night long just to make sure your brain and organs are getting enough oxygen.
Our final sign is snoring, but this comes with a huge warning label. While a deviated septum can absolutely cause snoring, you have to watch out for daytime fatigue, which points to a much more serious issue: sleep apnea. You see, restricted nasal airflow turns your airway into a kind of wind instrument, causing that loud, harsh snoring vibration. But if a partner's ever noticed that you actually stop breathing in your sleep, or if you're just relentlessly exhausted during the day no matter how much you slept, that goes way beyond a crooked septum. That requires immediate medical attention.
All right, Section 3, the 2-minute home test. It is time to check your own structure.
Okay, so you want to follow these exact steps, but only when you are totally free from a cold or an active allergy flare-up. Remember, we are testing the permanent structure here, not a temporary clog. Step 1. Gently blow your nose to clear out any mucus. You got to clear the scene of the crime before you investigate, right? Step 2. Close one side and breathe gently for 20 full seconds, paying close attention to any strain or resistance. Step 3. Switch sides and repeat. And this is crucial. Do this whole thing while sitting up and then do it again while lying down. Like we just talked about, gravity and your body position can drastically alter how open those airways actually feel. Now make sure you test yourself at a few different times of day.
morning, afternoon, and night. Jotting down a pattern like this helps an ear, nose, and throat doctor connect your symptoms so much faster than just relying on your memory. Let's be honest, when you're sitting in a doctor's exam room under those fluorescent lights, it's incredibly easy to forget exactly how you felt at 2 a.m. 3 nights ago. Keeping this little diary transforms you from someone just complaining about a stuffy nose into an empowered patient who is bringing actionable, structured data straight to the doctor.
Let's move to Section 4, decoding your test results. Time to analyze all that evidence you just gathered.
Now pay attention because this is a massive trap for a lot of people. Did you know your nose actually swaps its open side naturally every few hours? It's true. But a true deviated septum will present a relentless, repeatable pattern on the exact same side no matter what time of day it is. That natural swap is known as the normal nasal cycle, and it is 100% biologically normal. Your body does it to manage moisture and protect all that delicate nasal tissue. So if your blockage shifts from your left nostril to your right nostril throughout the day, that is literally just biology doing its job. But if that left side is always the bad guy, day in and day out, yeah, that's structural.
So if you notice a consistent block on just one side, that points straight to your septum, and it means it's time to call the ENT for a real evaluation. But if both of your nostrils are completely blocked, you're probably just battling a cold or having a really bad allergy day. Wait it out, treat those symptoms, and then run your home test again once you're feeling healthy. And as we mentioned, if you're noticing really loud snoring paired with intense daytime exhaustion, you need to look into a sleep test. Understanding these specific distinctions helps you figure out exactly what your next step should be without any unnecessary panic.
To make sure your little home screening is actually accurate, you want to avoid some super common mistakes. First off, never test during a sinus infection. Temporary swelling perfectly mimics a permanent structural block, so it'll totally throw off your results. Also keep in mind that regular old congestion, enlarged turbinates, which are just tiny structures in your nose that warm the air, and even nasal polyps can all reduce your airflow too. So don't immediately jump to the conclusion that your bone is crooked just because you had trouble breathing on one random Tuesday. We are looking for those relentless, repeating patterns.
Which brings us to our final section, Section 5, when to call an expert and get a proper diagnosis. According to the Mayo Clinic, if any of these specific symptoms stick around and refuse to clear up, like a persistently blocked nostril, repeated nosebleeds, or your sleep quality taking a serious hit, an official ENT examination is the only way to get a true diagnosis. Just shining a flashlight into your bathroom mirror simply won't cut it. The outside appearance of your nose doesn't always match what the septum is doing deep inside the nasal cavity. A professional literally needs to look way back there with a special light or an endoscope to confirm the actual physical structure and rule out things like severe inflammation or polyps.
Now, while saline sprays, steroids, and humidifiers are great for treating the temporary inflammation that makes things feel worse, you have to remember that a true deviation is a structural problem, and that means only a surgery, specifically a septoplasty, can permanently fix it. I know that sounds a little intense, but it's just the simple reality of our anatomy. Think of it like this. If a wall inside your house is built crooked, slapping a new coat of paint on it isn't going to straighten it out, right? If your symptoms are severely impacting your quality of life, correcting that physical structure is your definitive long-term solution. As we wrap up this explainer, I really want to leave you with this crucial thought to chew on. If your self-test revealed severe nighttime snoring or moments where your breathing actually pauses, could an at-home sleep test be your critical next step? Having a deviated septum is super frustrating, for sure, but poor oxygen intake while you sleep actively impacts your brain, your heart, and your overall longevity. So use this self-test to spark your curiosity. Start your symptom diary today, get curious about your health, and take control of the way you breathe.